We all want healthcare that's, the best it can possibly be. Safe, effective, always getting better.
Absolutely.
But sometimes figuring out how that improvement actually happens, well, it can feel a bit like a maze.
It really can.
And that's exactly what we're digging into today. Quality improvement committees, QI committees in healthcare.
Yeah.
Our aim here is to give you a really clear picture of why these committees is just so critical and how they actually work effectively, sort of cutting through the jargon and getting straight to what matters.
Think of it as your quick guide, your fast track to understanding this really vital engine driving progress in healthcare.
Exactly. So for this deep dive, we've pulled together information from some pretty key sources.
That's right. We looked at Joint Commission International JCI. They're a global leader in setting healthcare standards.
Right.
Then there's NABH, the National Accreditation Board for Hospitals and Healthcare Providers, which focuses on standards in India.
Okay.
We also looked at Supreme Medic Consultancy, who actually help hospitals with that NABH accreditation process.
It's interesting.
And ISQA, the International Society for Quality in Healthcare, another big international player focused on improvement. Plus, we've got several really detailed articles just looking at how these QI committees function day to day.
So a good mix of sources.
Definitely. And our mission really is to boil all of this down, to extract the core principles and, the practical insights that make a QI committee genuinely effective.
Okay, perfect. So let's jump right in. Why are QI committees so fundamentally important? What's the big deal here?
Well, at their very core, they are let's say, the driving force and the main oversight body for all the quality improvement work happening within a healthcare organization.
The driving force and the oversight.
Yeah.
Yeah.
They provide that central point for accountability, making sure resources are actually used strategically to hit quality goals, and crucially, that you can measure the progress being made.
Right.
The QI playbook, one of our sources, really emphasizes that this kind of oversight is just essential. It ensures that good intentions actually turn into, real results.
So it's not just about wanting to improve, it's about having a proper system to make it happen and check if it's actually, working.
Precisely. And a really key part of this is making sure all those individual QI efforts line up with the bigger picture.
The bigger picture.
Yeah, the organization's overall mission, its vision for the future, and its main strategic goals. Aligning everything across different departments and clinical areas ensures that improvement work is focused and actually helps the whole organization succeed.
That makes total sense. You wouldn't want, say, the cardiology department working on one quality initiative and the surgical unit on something completely different, maybe even conflicting.
Exactly. And that leads right into another vital function of these committees, breaking down those infamous silos.
Ah, the silos.
Healthcare organizations can sometimes operate like separate little kingdoms, right? QI committees really foster collaboration across these departments. They bring together people from different areas to tackle issues that affect everyone.
Like what kind of issues?
Things like developing standardized patient safety protocols, clear rules for things like giving medication or controlling infections to keep patients safe, or finding ways to make the whole operation run more smoothly, more efficiently. Things like reducing wait times or using resources better.
So getting everyone talking and working together on shared quality goals instead of just staying in their own little bubbles.
That's a perfect way to put it. And ultimately, the big overarching goal is to build and sustain a culture of continuous improvement.
Continuous, not just a one-off project.
Exactly. It's an ongoing commitment. QI committees are responsible for systematically looking at the data, carefully tracking how things are going, and then tweaking the strategies based on what they learn. Another source we looked at really reinforces this cycle. Analyze data, adjust strategy, repeat.
Okay, so we get why they're so important. Oversight, alignment, collaboration, continuous improvement. Now let's talk about who. Who actually sits on these committees? What are the essential roles?
Right, an effective committee needs the right people. The QI playbook outlines these pretty clearly. First off, you need a QI committee chair.
The chair. Okay.
This is usually a senior leader in the organization. Someone with real authority to oversee everything and make sure the quality strategy fits with the organization's big goals. Often, it's someone at the executive level who can really push for change across different parts of the hospital or clinic.
So the chair is the strategic leader, making sure quality is a top-down priority.
Exactly. Then, you absolutely need a QI coordinator or manager.
Coordinator or manager.
Right. This person is vital for the day-to-day running of things. They handle the practical stuff, collecting the data, doing the initial analysis, reporting on progress, basically keeping all the different QI projects moving forward. They're the ones working closely with the chair and the members to get initiatives implemented.
Ah, the person who really keeps the wheels turning on the quality improvement machine.
Precisely. Couldn't have said it better. Next up, you need clinical or operational leaders.
People from the front lines.
Exactly. They bring that crucial on-the-ground experience. For the clinical side, think physicians, nurses, people who see the patient care challenges and opportunities firsthand.
Right.
On the operational side, you've got department heads who really understand the daily workflows and can spot ways to make processes more efficient. Their firsthand knowledge is just invaluable.
They're the ones who can say, look, based on what we see every single day, these are the real problems we need to tackle.
Absolutely. Then there's the data analyst or quality data expert.
Ah, the numbers person.
Yes, and in today's healthcare, data is just everything. This person digs into the performance metrics, spots the important trends, and makes sure the committee's decisions are based on solid, accurate data. It's not just about crunching numbers, it's about turning data into stories that guide the committee. A good analyst can spot subtle things that might otherwise get missed.
Because you can't really improve what you don't understand and measure.
Right, exactly right. Another role that's becoming increasingly important is the patient or customer representative.
Oh, interesting. Bringing the patient voice in directly.
Yes, it's so crucial, especially in healthcare. They bring the perspective of the people actually using the services. They can talk about patient needs, concerns, experiences, making sure the quality work is genuinely patient-centered. Source 9 in our research really highlighted this growing importance.
That feels really vital. It's easy to get caught up in clinical details and maybe forget the patient's actual experience of care.
Absolutely. We also need a compliance officer.
Compliance, making sure everything's above board.
Pretty much. They ensure all the QI activities stick to the relevant regulations, industry standards, and best practices. They help keep the process ethical and within the rules.
Makes sense. Keeping improvement efforts aligned with legal and ethical standards.
Correct. And finally, you often have subject matter experts, or SMEs.
SMEs.
These are people with deep, specialized knowledge in specific areas. Maybe it's advanced patient safety techniques, or complex risk management, or infection control protocols. They provide that really specific technical expertise needed for certain improvements.
So a really effective QI committee is this mix of strategic leadership, hands-on expertise, data skills, patient input, compliance oversight, and specialized knowledge.
Exactly. It's a real multidisciplinary team, all pulling together towards that shared goal of better, safer care.
Okay, so you've got this diverse group of experts and leaders assembled. How do you actually structure this committee so it's genuinely effective? It can't just be about throwing them all in a room together, surely.
No, definitely not. Structure is key. The QI playbook gives some good pointers here. For starters, depending on how big and complex the organization is, you might need subcommittees.
Subcommittees.
Yeah, smaller groups that focus on specific areas like, say, patient safety or quality measurement techniques or maybe regulatory compliance. These smaller groups would then report back up to the main QI committee.
Ah, okay. So like specialized task forces feeding into the main strategy group.
That's a great way to think about it. And flowing from that, you need really clear reporting lines and accountability. Absolutely essential. Everyone needs to know who they report to, what their specific responsibilities are. Maybe the QI manager reports to the chair, data analysts report to the coordinator. Clear pathways so decisions get made efficiently and everyone knows their part.
Avoids confusion and makes sure tasks don't fall through the cracks.
Precisely. Then there's the rhythm of the committee. Regular meetings are crucial.
How regular?
It depends. Maybe monthly, maybe quarterly. Depends on the organization's needs and how fast things are moving. But they need to meet consistently to review progress on projects, talk openly about challenges they're hitting, and spot new opportunities for improvement. Source 14 also really stressed the value of these regular check-ins.
Keeps the momentum going and ensures problems get tackled quickly.
Exactly. And to make those meetings and the work between them run smoothly, you need defined decision-making processes.
How they actually decide stuff.
Yeah. Agree up front. Is it a simple majority vote? Or do we need everyone to agree a consensus on key decisions? Getting that clear early on avoids getting bogged down later.
Stops things getting stuck in endless debate. Good point.
Right. And finally, a really key structural element is making sure you have representation from across the board. Different departments, different levels within the organization.
Why is that so important?
Well, it brings diverse perspectives, right? But it also helps with sharing resources and insights from different corners of the organization. It ensures the QI work is comprehensive and has buy-in from various areas.
So it's about making sure the committee truly reflects the organization it serves and has broad support.
Absolutely. A committee that reflects the diversity is just much more likely to drive real, meaningful change.
Now, a committee can look perfect on paper, great structure, all the right roles, but if people aren't engaged, if communication isn't flowing, well, it's not going to achieve much, is it?
Not at all. Engagement and communication are like the absolute lifeblood of a successful QI committee. The QI playbook really hits on this too.
So what does good engagement and communication look like in this context?
Well, first, you need clear, reliable communication channels. Simple things, right? Like regular email updates, keeping everyone in the loop.
Okay.
Or maybe using shared online platforms where members can easily find the latest project info and data. Some places use collaborative software to track discussions and progress. The key is making information flow easily and transparently.
Keeping everyone on the same page.
Exactly. Second, and this is huge, you need visible, active involvement from senior leadership.
The top brass needs to be involved.
Absolutely. When senior leaders don't just sign off on QI, but actually participate, maybe attend meetings sometimes, ask questions, it sends a really powerful message that this stuff matters.
Right.
Plus, keeping leadership updated on wins and challenges helps build momentum and secure ongoing support and, importantly, resources. Sources 14 and 15 also pointed this out.
Yeah, if the CEO is asking about it, people tend to pay attention.
Precisely.
Yeah.
Another vital piece is creating feedback loops. Ways to get input from staff and other stakeholders.
How do you do that effectively?
Various ways. Regular surveys can gather opinions. Town hall meetings to discuss initiatives openly. Workshops where staff can actually suggest improvements or give feedback on current projects. Sources 3, 13, and 14 all stressed how valuable these feedback mechanisms are.
Making sure people feel heard and their input is actually valued.
Exactly. And finally, don't forget to celebrate the wins.
Celebrate.
Yeah. Acknowledge achievements, both the small milestones and the big successes of the committee and its projects. It's a huge morale booster and motivates everyone to keep pushing for improvement. Publicly recognizing hard work reinforces its value.
A bit of positive reinforcement goes a long way, keeps the energy up for the long haul.
Absolutely. It really does.
Okay, so let's say someone listening is thinking, right, we need to build a better QI committee here, or maybe start one. What are the absolute key steps? We've covered a lot, but can we boil it down into actionable steps?
Yes, definitely. We can pull together the key takeaways from our sources. The very first crucial step is define your purpose and scope really clearly.
Purpose and scope. Okay.
This means setting SMART goals specific, measurable, achievable, relevant, and time-bound for what you want to improve. That's straight from the QI playbook and several other sources too.
SMART goals. Got it.
And it also means deciding your focus. Is this hospital-wide? Or are you targeting specific departments or services? Be clear on the boundaries. Sources 2, 7, and 8 mention this.
So start with knowing exactly what you're aiming for and where you're focusing. Crystal clear.
Exactly. Second key step. Build diverse membership.
The right mix of people.
Yes. Involve stakeholders from different departments, different levels, clinicians, nurses, administrators, quality folks, and, as we mentioned, definitely patient representatives. Sources 2, 3, and 9 all highlighted this. And ensure you have a good blend of skills, clinical know-how, data analysis chops, change management skills. That came up in sources 9 and 10. And crucially, define clear roles, chair, secretary, etc., spelling out who's responsible for what, especially around data and reporting. That's in sources 2, 11, and 12.
Right people, right skills, clear jobs. Makes sense. What's next?
Third step. Establish a structured process for how the committee actually works.
The how-to self.
Yeah. How do you identify problems? Use data, use patient feedback, use staff reports. That was in sources 1 and 10. Once you've identified an issue, how do you find solutions? Brainstorm, look at evidence-based practices, sources 1, 2, and 10 again.
Okay.
Then develop and implement your change plan. Clear communication about the plan, proper training for staff involve sources 1, 3, 13. And finally, and this is critical, monitor progress. Track the data, see if the change is working, and adjust as needed, also from 1, 3, and 13.
So a systematic cycle. Identify, plan, implement, monitor, adjust.
You got it. And the fourth key step is ensuring the foundational elements for success are in place.
The foundation's like what?
Strong leadership support is paramount. visible backing, and crucially, allocating the necessary resources, time, people, budget. This came up again and again in sources 14 through 18.
Leadership buy-in and resources.
Yes, sir.
Critical.
Absolutely. Then, maintain that open communication we talked about within the committee with stakeholders. That's 3, 13, 14. Adopt a data-driven approach. Let the numbers guide you. Source 1 really hammered this home.
Data, data, data.
Yes. And finally, actively foster that culture of continuous improvement. Make it normal to always be looking for ways to get better, to learn, adapt. That was in sources 2, 13, and 19.
So leadership support, open communication, data focus, and a continuous improvement culture. Those are the cornerstones.
Precisely. Get those 4 steps right, and you're well on your way to an effective QI committee.
We've talked a lot about the theory, the structure, the why, and who. Let's get practical now. What kind of things do these committees actually do? Can you give us some concrete examples of their activities?
Absolutely. They're involved in a really wide range of activities, all focused on making care better and safer. For example, think about technology. They often oversee the implementation and, importantly, the ongoing optimization of things like electronic health records, EHRs, and data dashboards. These tools are powerful for tracking patient data, spotting trends. Sources 20 through 23 mention this.
Using tech to get smarter with data.
Makes sense. Exactly.
Yeah.
They also work on developing and implementing standardized protocols.
Standard rules for doing things.
Yeah, for common procedures. It could be something fundamental but critical, like standardizing hand hygiene practices. Sources 24 to 26 talked about that, or maybe standardizing how pain is managed across different patient groups.
Ensuring everyone follows the same evidence-based approach.
Consistency.
Correct. And a huge focus always is improving patient safety directly.
How so?
They develop and push strategies to reduce preventable harm. Things like minimizing medication errors, cutting down on hospital-acquired infections, Source 27 touched on this, or implementing protocols to prevent patients from falling.
Tackling those major risks head on. Exactly. And as we touched on earlier, there's a growing emphasis on actively seeking out patient feedback and involving patients more in their own care decisions.
Bringing the patient perspective right into the improvement work.
Precisely. Maybe through regular surveys or setting up patient advisory councils, making sure the patient voice is heard and acted upon. Sources 3 and 13 highlighted this again.
Truly patient-centered improvement.
Exactly. So, yeah, those are just a few examples, but you can see the breadth and the impact of the work these committees do.
Okay, we mentioned them briefly at the start, but let's talk specifically about the big accreditation bodies like JCI and NABH. How do they fit into this picture? What's their role regarding QI committees?
Right. Accreditation bodies like JCI and NABH play a really significant role. They kind of set the bar. Joint Commission International, JCI, is, as their website says, a global leader. They set international standards for healthcare quality and patient safety.
The global benchmark.
Pretty much. Their mission is about enabling and affirming the highest standards, and their accreditation is recognized worldwide. Often, the standards set by bodies like JCI actually require certain structures and processes for quality improvement.
So JCI might say, you must have a process for reviewing X patient safety data.
Exactly. They might mandate regular data-driven reviews of specific safety indicators, which directly shapes what a QI committee needs to focus on and how it operates.
Got it. And NABH.
NABH, the National Accreditation Board for Hospitals and Healthcare Providers, is part of the Quality Council of India. Their website explains they were set up specifically to create and run accreditation programs for healthcare organizations in India. They established benchmarks to drive improvement within that specific healthcare system.
So the key accreditation body focused on India.
Correct. And we noted that Supremedic Consultancy, based on their site, actually helps hospitals navigate that NABH accreditation process. And then there's ISQA, the International Society for Quality in Healthcare. Their website describes them as an international membership-based organization promoting QI globally. They do this through education, sharing knowledge, external evaluations. They support health systems in over 70 countries.
So ISQA is more about providing resources and networking for quality improvement globally.
Exactly. They provide that global network and knowledge base. Now, the crucial link here is that the standards and frameworks set by bodies like JCI and NABH often necessitate having effective QI committees.
So meeting accreditation standards often requires having a functioning QI committee.
Yes. These bodies provide guidelines and expectations around quality improvement processes, data collection, patient safety initiatives, continuous monitoring, all things that are core to what a QI committee does.
Right.
So In essence, the work of a QI committee directly helps an organization meet those stringent accreditation standards. And it aligns perfectly with the broader goals of organizations like ISQA, aiming for safer, higher quality care everywhere.
So QI committees aren't just internally driven, they're also a critical piece for meeting external benchmarks and gaining that important accreditation.
Precisely. They're absolutely fundamental to that whole ecosystem of striving for excellence in healthcare, both within the organization and in line with global best practices.
Well, this has been a really, really insightful deep dive. It feels like we've thoroughly unpacked the world of QI committees.
I think we covered a lot of ground.
Yeah. To quickly recap, it sounds like these committees are just essential. They ensure healthcare organizations don't just talk about quality, but actually have the structures and processes to make it happen.
Right. They provide that accountability.
Accountability, alignment across departments, that crucial collaboration, and fostering that culture of always improving.
Spot on.
And effective committees, they need those clear roles, a solid structure, great communication, and they have to be driven by data.
Data is key.
And organizations like JCI and NABH, they set the high standards that these committees help organizations strive for and achieve.
That's an excellent summary. You've really nailed the core ideas and why they matter. For you, our listener, hopefully this deep dive gives you a much clearer picture of one of the key ways healthcare organizations work tirelessly to make care safer and better through these dedicated committees.
Definitely. And maybe one final thought to leave you with. Healthcare is getting more complex all the time, isn't it? New tech, new treatments, new challenges.
Constantly evolving.
So how crucial do you think these well-oiled QI committees will be in navigating all that future complexity and making sure we get the best possible outcomes? It really makes you think, doesn't it?
It does.
And maybe even consider how these principles, structured improvement, collaboration, data-driven decisions might apply in other complex fields you're familiar with. Something to ponder. Thanks for joining us for this deep dive.